Okay, we looked at Fauci. Here,
Day
let's hear the
average of
CDC
new
director explain the new
coronavirus
COVID
cases, as the new
isolation rules as
Omicron
well.
variant accounts for nearly 60% of cases in the U.S. now, according to the CDC. Joining us now is the CDC director, Dr. Rochelle Walensky. Dr. Walensky, thank you for being here with us this morning. And I want to start with the change in the...
My favorite is when the New York Times just fucking gave up on, you know, not paywalling important news. You know, the gray lady, by the way. And just straight up absolutely fucking paywalls it now. They're like, yeah, you need to subscribe if you want to see this like important COVID news. Okay, cool. Thanks. Anyway, here, let's hear what Rachel Walensky has to say.
Dr. Walensky, thank you for being here with us this morning. And I want to start with the change in the CDC guidance that cuts the isolation period in half if you're asymptomatic. So how did the CDC settle on 5 days for everyone?
Good morning, Caitlin. Thanks for having me. So we looked at several areas of science here. First, the science of how much transmission happens in the period of time after you're infected. We know that the most amount of transmission occurs in those 1 to 2 days before you develop symptoms, those 2 to 3 days after you develop symptoms. And if you map that out, those 5 days account for somewhere between 85 to 90% of all transmission that occurs. So we really wanted to make sure that during those first 5 days, you were spent in isolation. That's when most of it occurs. And then there is, of course, this tail end, a period of time in those last 5 days, where we're asking you to mask. But the other things that we were looking at is the epidemiology here. We are seeing and expecting even more cases of this Omicron variant. Many of those cases are mildly symptomatic, if not asymptomatic, and especially among those who are vaccinated and unvaccinated. And then finally, the behavioral science. What will people actually do when people need to get back to work? What is it that they will actually do? And if we can get them to isolate, we do want to make sure that they're isolating in those first 5 days when they're maximally infectious.
So from what you're saying, it sounds like this decision had just as much to do with business as it did with the science.
Well, so it really had a lot to do with what we thought people would be able to tolerate. We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of people are isolating when they need to.
And honestly, we've been doing a fucking, you know, gangbuster job regardless, you know, even with the relatively low rate of isolation, right? Is that what's going on? Aren't you literally fucking admitting that that's the problem? How do you admit that that is an issue in a country where more than 800,000 people have fucking died of COVID? And then you're like, and because of that, that's why we're lowering it even further? This doesn't make any sense, dude. It does not make sense at all. I can't believe the conspiratorial minds over at CNN asking these sorts of questions, by the way. It's so fucked up and such a big conspiracy. And I can't believe that Dr. Rochelle Walensky, the director of the CDC, is also, I guess, engaging in the conspiracy theory seriously, alongside Dr. Anthony Fauci and every other fucking communicator that has spoken out about this so far, about how, yeah, this is partially to do with businesses and partially to do with the economy maintaining itself. You know, that's great though. That's cool that I guess everyone is in on the conspiracy theory. The science that they're referencing is not new science, by the way. That's the problem, which means that I guess they misinterpreted the old science thus far.
And so we really want to make sure that we had guidance in this moment where we were going to have a lot of disease that could be adhered to, that people were willing to adhere to, and that spoke specifically to when people were maximally infectious. So it really spoke to both behaviors as well as what people were able to do.
Well, so then I guess the question, if this is based on science that you already had at the CDC, why didn't you make this change sooner than this week?
Well, so our guidance...
Because the shortages weren't as exhaustive until this week, because Omicron spreads like a motherfucker, okay? That's the reason. That's literally the reason. Either you have to now admit, like, oh, based on our interpretation of the old data, we were just fucking wrong, and people should have been, you know, isolating for 5 days instead of 10, which, by the way, that's not even the case. That's not even true. They're not going to ever say that. You know why? Because she already admitted that no one was fucking isolating. The problem with what the CDC does, regardless of what the public ends up doing, is that the CDC is the dam, okay? They are the final barrier. They are the legal mechanism that offers at least some kind of fucking ground for local governments to take action, for the government, for the federal government to take action. So when they lower that fucking restriction, it's over. It's done. They broke the dam, okay? Now, Republicans can do whatever the fuck they want. They can turn around and use this against the federal government. They can turn around and use this against the CDC. Why did they say it was 10 days when it was actually 5? Look at them saying it was 5 days now. I told you this was bullshit. This is the issue that I have. The CDC is, once again, just like in the beginning of the pandemic with the mask shit, undermining their own authority and fucking it up, okay? And botching it. What is this? Stop, dude. Come on. Newbie Bug, thank you for the 10 gifted subs. Here's the paragraph in the New York Times. As daily coronavirus cases in the United States soared to near record levels, federal health officials on Monday shortened by half the recommended isolation period for many infected Americans, hoping to minimize rising disruptions to the economy and everyday life. That is the reality. Omicron, as far as we know, is a super spreader, okay? It spreads very fast. It went from representing only 3% of new COVID cases to 78 in a matter of 7 days, a couple weeks back. Everywhere where Omicron is spreading, all across the world, they have hundreds of thousands of cases, okay? It's just the reality. So for that reason, wasn't that 78 number changed? Oh, they did it? They revised it to 58? My bad. I didn't see that. I thought it was 78%. It's 58%. It was 78, but they revised that number. See? New information can fucking oftentimes be wrong. Omicron is not Delta. It's not as potent. Why is it fucking lost on you? It's not. It's not lost on me. But one of the things that if you listen to me talk to Dr. Eric Feigl-Ding, for example, who's an epidemiologist, one of the things that epidemiologists are worried about is interpreting the data in other countries and then thinking that that's going to work in a similar capacity here in the United States, where in the United States we have higher rates of comorbidities and also way, way lower rates of people who actually have gotten the vaccine. Okay? We got a lot of big boys. One of the things that many of the healthcare professionals and many epidemiologists are worried about is people falsely assuming that because they got COVID already and aren't vaccinated, that they will be fine with Omicron. Omicron rips through the supposed natural antibodies that you may or may not even have. Once again, I have to repeat myself, deaths are a lagging indicator, and we already have 1,500 deaths a day on average here in the United States of America. Okay? Now that's lower than last year, but last year there weren't any vaccines. This year we have vaccines and we still have 1,500 people dying every day. Just because you don't see it in the news as much, just because it's not being fucking hit in the back of your dome every single day like it once was, when it was fashionable to use it against Donald Trump as a talking point, does not change that reality. Okay? If you have unvaccinated people in your lives, they are still severely compromised. Okay? Be fucking safe. I work in the ICU. Most of the patients with COVID have comorbidities. While it's good they're pushing the vaccine, shouldn't they also push living a healthy lifestyle to the same capacity? Holy fuck. A nurse not bringing up nurses and doctors and healthcare professionals not bringing up people's weight challenge is impossible difficulty. Okay. No, it's not a Joe Rogan take. This is just like a meme in healthcare that like and they're right because they are correct. They are correct. If people were healthier and had less comorbidities, then, you know, COVID would be less deadly to this population. So Mr. C Gaming is correct. It's just funny because it's literally like, you know, good luck. All I'm going to say is this, okay? All I'm going to say is this. I hope I'm fucking wrong. I hope I'm so wrong with my fear here that the CDC is just caving to the interest of business, and actually that like the gamble that they are operating on currently is completely correct, and that COVID is not going to fucking rip through the population, okay? I hope I am so wrong, and just I'm cautious, and I hope I am incorrect in my assessment here. But I don't think I am. And those who are hyper focusing on like the capital side of this argument and saying like, oh my God, it's so fucked up. You said the poor Delta airline CEO, you threw him under the bus like this. Like, we are not on the opposing side of one another on this argument, okay? Unless you're like literally an anti-vaxxer, you fucking weirdo. In which case, we absolutely are not on the right. We are not, you know, we're not in agreement there. But if you're one of those fucking liberals that comes in here to be like, you're so stupid, we fucking owned you in an argument, like, I hope I'm wrong. The idiots on Reddit have refined their arguments to turn LSF against you already. I mean, that would have happened very quickly, okay? If you spend your entire time on Reddit, like, you know what Reddit expectations are. Muddiest guideline ever. Tell me what's wrong with this CDC Gov rule. Besides zero testing for early isolation exit, it says you can simply leave the house if your symptoms are resolving. In what universe is that considered a clear guideline? It's dangerously muddy. People will definitely abuse that vagueness to be blasé and ignore isolation. Business will abuse it too, to the detriment of public health. Meanwhile, here is how UK rightfully sets clear-cut isolation guidelines with 2 negative tests on top. Like in the UK, they lowered it from 10 days to 7 days, I believe. But when they did that, they also accompanied that with still negative tests with negative testing. People are just upset that as of now, you were right that they were going to prioritize profits over people. That's too lefty for some folks. Yeah, it's fucking psychotic. Anyway. My hospital, level 1 trauma center, treats all sorts of illnesses and age groups. Is actually running out of COVID swabs right now because there's so many full families that are coming in our ER to get swabbed. We're already so overwhelmed with patients that our lobby has moved to the central hub of the hospital. Satire TikTok regarding the CDC response.
Yes, you.
So are the zombies capable of...
We don't like to use the Z word at the CDC. We are talking about a virus that reanimates the deceased and sustains itself through a consumption of human brain tissue, and that doesn't sound anything like a zombie to me. That's a term that folks in the media like to use to stir up anxiety. But I do want to address what I think is people's real concern here. and that's the economy. If there's anything that needs to come back from the dead, it's jobs. If you are bitten, you can stay at work up until the moment you begin to crave human brains. And I think we really want to get that message out there. I take this opportunity to share with you the CDC's Bite to Work program, which consists of just a few... Yes, you.
So are the zombies capable of...
We don't...
One of my coworkers went to the hospital to try and get a COVID test because they were offering them in a 10-down size. She said there was like a line of 50 people. Anyway, didn't they find asymptomatic people that were shedding the virus for well over 30 days? Look, there's always going to... Look. There's a lot of uncertainty here because as far as we know, a big part of the problem is your viral load, okay? Big part of the problem is like how much of a viral load you got. That determines, along with a bunch of other factors, how much antibodies your body naturally creates and the staying power of said antibodies, all this stuff, okay? That's part of the reason why we advocate for the vaccine, that we urge people to get the vaccine, because there's an inconsistency there. But just because there's people that are still fucking, for example, spreading the virus maybe 30 days in, does not mean the quarantining process should be 30 days. And I'm not even anti making the quarantine process 5 days. I just want to make sure, and I want to see such a big decision be accompanied by actual fucking data, new data, not a reinterpretation of the old data. Or if it's a reinterpretation of the old data, I want there to be clear communication on why the original data that was interpreted in the way that it was interpreted in such a way. It's not that fucking ridiculous. You can't just all of a sudden decide, yeah, we were just wrong for the past year. And it's a 5-day thing now. Just kidding. When you do that, people make fun of you, understandably. By the way, the quarantine precautions were in respect to your exposure. 14 days after exposure, 3 to 4 days for the symptoms to show, 3 or 4 days for you to almost die, and another 7 days to be fully clear of the viral load. Thus, 14 days. It was never based on if you're infected, start your quarantine now. Anyway, well, let's see. The new director of the CDC.
Yeah, till July sounds like a bunch of bullshit. I'm sorry. But, like, it's a virus. I get it. Like, I respect it. But at the same time, like, even if everybody gets it, like, yeah, people are gonna die. It's just terrible. But, like, inevitable? I don't know. Maybe I shouldn't be doing this right now.
It's true. Oh, she said this last year, by the way. But hey, turns out she was right all along, baby. That's what the CDC said. You guys have a problem with that? Listen, motherfuckers, you can't be coming into my chat and telling me I'm a conspiracy theorist for criticizing this exact same take from the fucking CDC. Okay? Oh, Jesus Christ, dude. They hated her for telling the truth. Not only her, but like everyone that said, some of you are going to die, but that's a risk I'm willing to take. That meme. It's true. That's basically what the fuck is happening right now. Okay? Some of you are going to die, but that's a risk I'm willing to take.